Movement, Chapter 3. Voluntary movement is movement that is consciously controlled. Muscles are the structures of the body that produce movement, most attached to the skeleton or span joints. Muscles that attach to the skeleton are called skeletal muscles. Types of muscles. Flexor muscles are muscles that bring bones together. Extensor muscles are muscles that straighten a joint. Flexors and extensors work opposed to one another. When you're lifting a weight, the bicep contracts and the tricep extends. This is called co-contraction because both the flexor and the extensor are working together. Some muscles don't act on joints. Instead, they act on soft tissue, such as the head, neck, eyes, and mouth. These are responsible for chewing, swallowing, and facial expressions. Agonists versus antagonists. Agonists are the muscles that promote the movement. Antagonists are muscles that oppose or inhibit the movement. Muscle components. Muscles are made up of thousands of muscle fibers. Each muscle fiber is controlled by one alpha motor neuron. However, one alpha motor neuron can control a few to 100 muscle fibers. A motor unit is an alpha motor neuron and all the muscle fibers that it controls. Alpha motor neurons are most often located in the spinal cord. Reflexes. Reflexes are fixed automated responses to certain stimuli. Let's talk about stretch reflex first. Stretch reflex is a myotatic reflex. An example of stretch reflex is the knee-jerk reflex. When a physician strikes your tendon with a hammer, the tap produces slight stretch of the knee extensor muscles. The muscle spindles sense the extent and the speed of the stretch. They send impulses to the spinal cord and the muscle contracts. The flexion withdrawal and crossed extension is another type of reflex. Flexion withdrawal reflex occurs when your bare foot encounters a sharp object. Pain receptors in the skin send a message to the spinal cord. The alpha motor neurons that are located in the spinal cord are activated, and the leg is immediately lifted. This is called a flexion. At the same time, because your body weight is supported on both legs, the extensors of the opposite leg must be activated so that you don't trip and fall. Complex movements involve many mechanisms. The four main mechanisms are spinal circuits, motor cortex, central pattern generators, and higher brain regions. Starting with the spinal circuits. The spinal circuits are located in the spinal cord, and they play a critical role in controlling more sophisticated voluntary behavior, such as the alternating action of the legs during walking. This is called locomotion because it is rhythmic. Central pattern generators evolved in primitive vertebrates and are being studied to determine the degree to which spinal circuitry can be co-opted to recover basic postural and locomotor functions after severe paralysis. The motor cortex is the region of the brain in which the neurons send signals that directly control the activation of alpha motor neurons in the spine. By controlling the alpha motor neurons, the motor cortex can help finely tune motor skills, or it can coordinate movement of a limb to a particular point in space. The different regions of a motor cortex control movement of different parts of the body. Higher brain regions are important for initiating voluntary motion, coordinating complex sequences of movement, and tailoring behavioral output to suit a given situation. They're important because they control the spinal circuits. Problems with movement can cause different movement disorders. 4 main movement disorders focused on this chapter are Parkinson's, Huntington's, cerebellar dysfunction, and the amyotrophic lateral sclerosis. Parkinson's disease is a disease caused by the lack of dopaminergic neurons in the basal ganglia, especially in the substantia nigra. It involves various symptoms including bradykinesia, vocal symptoms, rigidity and postural instability, tremors, walking or gait difficulties, dystonia, mental/behavioral issues, sense of smell, loss of sense of smell, sweating and melanoma, and gastrointestinal issues and pain. Huntington's disorder is due to lack of inhibitory neurons in the basal ganglia. Signs of progressing Huntington's disease include increased involuntary movement, weakness, severe depression, falling, difficulty swallowing and chewing, speech issues, and fever. Cerebellar dysfunction is caused by problems to the cerebellum. It involves poor coordination, disorder of balance, and even difficulties in speech. A causation of cerebellar dysfunction can be chronic alcohol abuse.